This is our friend Steve. He has borderline personality disorder. You might be wondering what that means, so let's take a look. Borderline personality disorder is a mental health disorder that affects approximately 1.4% of the US population. 75% are thought to be women. However, men may be just as likely to have it and are frequently misdiagnosed with disorders like PTSD or depression. Borderline personality disorder, or BPD, usually starts during early adulthood. The disorder typically gets better with age and treatment. So what are the symptoms of BPD? Well, the hallmark of BPD is extreme difficulty regulating emotions. People with BPD feel their emotions very intensely and have difficulty returning to a stable baseline. Symptoms of BPD include mood swings, inappropriate anger towards others, wild mood swings in relationships, such as idealizing someone one minute and then disliking them the next. Fear of abandonment. Instability and insecurity, which can lead to shifting goals and values. A range of impulsive behaviors, such as substance abuse, binge eating, excessive spending, risky, unsafe sex or promiscuous behavior, and suicidal actions or self-harm. Other symptoms include paranoid thoughts, difficulty trusting others, sudden depression, dissociation, and a feeling of emptiness. BPD can have a damaging effect on many areas of life. Let's look at the possible consequences of having BPD. Legal issues, not completing education, repeated job changes or losses, unplanned pregnancies, motor vehicle accidents, or attempted or completed suicide. Other possible consequences include relationship stress or conflict, involvement in abusive relationships, physical fights, or sexually transmitted infections. Now let's take a look at the causes and risk factors. BPD is not caused by one single factor, but rather by a combination of factors. Genetics, environment, and brain function. BPD is a serious disorder that until pretty recently was considered essentially a death sentence. Thankfully, new treatments have been developed and BPD is usually considered treatable. The most effective treatment for BPD is dialectical behavior therapy, or DBT. Other types of CBT therapy, medication, and sometimes short-term hospitalization when needed are also used. Some stereotypes and perceptions of people with BPD are that they are manipulative, selfish, or clingy. In reality, these behaviors are usually due to their illness. BPD is very difficult to live with and most people are just doing the best they can with the skills that they have. This is a quote from Marsha Linehan, the creator of DBT. People with BPD are like people with third-degree burns over 90% of their bodies. Lacking emotional skin, they feel agony at the slightest touch or movement. Learning to regulate the symptoms of BPD is possible, but it's a long and very difficult road. Hopefully this has given you a little more sympathy for what it's like to live with BPD. Finally, remember that BPD, or any mental illness, is not all of who a person is. Thanks for watching.